In our previous video, we discussed the lifestyle changes that can promote cardiovascular health. In this video, we will touch on the other side of management, medications. We'll discuss common medications that are used to treat high cholesterol and hypertension, and those that are used for patients with a history of heart problems. One of the most common problems in the United States is high cholesterol. The reason this is important for ED is the high cholesterol can clog the arteries that are going to the penis, effectively causing ED. Therefore, it's important that when you have high cholesterol, it is treated appropriately. The most commonly used medications to treat high cholesterol are called statins. These medications are easily recognized because they all end in the word statin. So who should be taking a statin? Guidelines developed by experts recommend taking a statin for prevention of cardiovascular disease for the following individuals. For anyone over the age of 21 years old with an LDL, which is bad cholesterol, over 190. Anybody who is between the age of 40 to 75 with diabetes and an LDL between 70 to 189. Anyone who has a history of cardiovascular disease, and anyone with an ASCVD risk score greater than 7.5%. This is a calculation based on the 10-year risk of having a cardiac event like a heart attack. For patients who cannot take a statin or need additional medications to help lower their cholesterol, there are many other classes of lipid-lowering medications that are also effective. As always, it is important to talk to your doctor about the risk and benefits of starting a new medication. Next, we want to talk about hypertension, or high blood pressure. High blood pressure can help the bad deposits in our blood eventually become atherosclerosis, sticking to the walls of the vessels. It is also a condition that is commonly associated with erectile dysfunction. If you have hypertension, it is important to treat it appropriately. There are many different effective medications used in the management of high blood pressure. These include ACE inhibitors, which end in the term pril, ARBs, which end in artin, beta blockers, many of which end in olol, calcium channel blockers, many of which end in dipine, and diuretics or water pills like hydrochlorothiazide or HCTZ. In short, there is not a single best blood pressure medication because everyone reacts differently to these medications. Oftentimes, the medications are used in combination with other medications to maximize their effects. The decision of which blood pressure medication regimen is appropriate is patient-dependent and should involve a discussion with your physician based on the benefits, effectiveness, risk, and side effect profiles. Finally, many men ask whether or not they should be taking a baby aspirin. Studies have shown it can be beneficial in certain groups based on risk factors and a calculation that determines if you're at risk for an adverse event such as a heart attack or stroke. The recommendation is that adults aged 50 to 59 with a risk score greater than 10%, based on the method developed by the American Heart Association, should take a low-dose aspirin or baby aspirin daily. You can find your risk by checking a calculator online to determine your own risk, and you can do this by searching ASCVD on a search engine. Patients with a cardiac history, meaning a history of a stroke, heart attack, intermittent chest pain, or mechanical valves, may benefit from additional anti-clotting medications. It is important to talk to your cardiologist about these medications to make sure that these medications are indicated and that the benefits outweigh the risk for your medical condition. Together with lifestyle modifications, the medications discussed in this video provide benefit in preventing the development or worsening of cardiovascular disease.